Greetings from Delhi Medical Association and eMedi News. Welcome to our show, Chat with Dr. KK. Today we are going to have a chat with Dr. Rakesh Sharma, who is an international fellow, College of American Pathologists, and who owns a North Delhi pathological clinic in New Delhi. Welcome to our show.
Hello, how are you?
My question is very simple, that TB is rampant in our society.
Yeah.
People have been misusing, and the RNTCP Act, with that we have lots of, to some extent there is a control, but we still get cases of drug-resistant tuberculosis, XDR, MDR, and a common man is confused. A common doctor is also confused that if I need a culture, where do I send? Am I going to wait for 6 weeks? Right. Nobody wants to wait for 6 weeks. Today, in today's scenario, if I want to start anti-tubercular treatment, and I also want to simultaneously see whether my patient is not suffering from MDR, what are the options available in the year 2013?
In the year 2013, a boon in disguise, I would say, was terrorist threat, which led to presence of those spores, which led to which were used as a letter passes. So what US Post did was they wanted to have a DNA test to detect those spores, and they came out with a technology which is now used as Gene Expert by using Gene Expert technology, and in which expert TB test is done. So the advantage
basically you're detecting the antigen of the tubercular bacilli.
You are actually, it is a molecular confirmation of, it is not antigen, it is molecule itself, it is a molecular test. So we know for sure that we are dealing with mycobacterium.
Will never give you a false negative?
No. The biggest advantage is that the material that you are processing should have 30 microbes, 30 colony forming units of tuberculosis per ml, which is quite small amount.
It will give you a diagnosis in how many hours?
2 hours.
2 hours. And what about sensitivity?
The biggest advantage that they have added is that to rule out MDR, that is multiple drug resistant tuberculosis, which is rampant, can be detected by this, and we can say it for sure that person is rifampicin resistant, or the mycobacterium is rifampicin resistant or rifampicin sensitive.
So only one drug?
Only one drug, because rifampicin resistance is considered as a benchmark for MDR.
And what about others? If I want to know sensitivity for others?
Right. Now, I have been using this expert TB test for about a year now. Now, as a principle, what I have done, as a protocol that I have adopted now, is that whichever test which I process, I put it simultaneously on slope. So I do the culture as well. And suppose on all positive cases, we wait for 6 weeks, and on all negative cases, we wait for 6 weeks, so that we can know it for sure that if it is positive or negative, and if it is positive, and if it is the doctor wants sensitivity, we can afford to give sensitivity also, because we are growing it on LJ slope, and we may get results in 6 weeks, we may get results in 4 weeks, we may get results in 2 weeks.
Will this nucleic acid test will also be available, molecular test for leprosy and other conditions?
I don't know how the biggest problem is that amount of work, volume of work that is being done in only developed countries can afford this work, and leprosy is not a problem over there. They are scared of tuberculosis.
Let me go away from the topic. If you would not have been a doctor, what you would have become?
I would have been an administrative officer like my father.
Like an IAS, IPS, IRS?
My father was an IAS.
IAS officer. Yeah. So you would have been ruling the country.
I always wanted to have policies in order.
Okay, if you would have been an administrator today,
yeah,
the Minister of Women and Child Development, and the Law Minister, what changes you would have brought in after this rape case, gang rape case?
Fast track court.
Fast track court means fast track decision or fast track courts?
Fast track courts who should be able, time bound. 3 months should be the maximum which a lady should suffer, or 3 months should be maximum which person can remain scot-free, and either he should be punished or he should be acquitted. I mean, we have got large number of politicians having cases. They are having it for 20 years.
My last thing is that do you feel that with every PCR van, the police van, either a paramedic should be posted or the policeman should be trained in cardiac first aid and the first aid?
See, cardiac first aid
And first aid, both.
First aid is a very basic thing. A 3 days or a 6 days module can be made for each and for a lay person, and he should be trained for it.
Even
So
the
we
policeman
can-
should be trained.
A policeman should be trained. You know, he is man on spot. He is the man on
So
spot.
what Dr. Rakesh very clearly says is in the diagnosis of tuberculosis, we have new modalities, and quickly within no time we can also find out whether the drug is sensitive or resistant to rifampicin. And let's thank our guest Rakesh.
Thank
Thanks
you.
to be in our show.
Thank you,
We'll come
Dr.
back with one more show. Till that, goodbye. Thank you.